sick beds and oxygen tanks in hospital corridors. 70 patients treated in just 2 hours in a village clinic. These are images from a health system in rural China that's under severe strain.
最缺啥子药？
最基本的简单的止痛的，抗病毒的那类型的。
退烧药没得吗？
也是紧切的。
Now, a reporter from the Beijing News has exposed the extent of the problem in the country's rural southwest. In many villages, elderly people must walk 2 hours to get medicine.
The
Beijing News account challenges the official narrative that COVID-19 medication has reached those living outside major cities.
这些药品和抗原已经发放到基层。
Chinese state media has U-turned recently, saying that the Omicron variant is less severe than previous strains. That's as COVID cases have been surging across the country.
会出现比较多的感染的患者，这是很显然的，而且它一定会有一定比例的肺炎的病人。
The Beijing News, which is owned by the Chinese Communist Party, says the drug shortage has been resolved. But questions remain about the true extent of COVID in China.
It's actually quite difficult to understand what's going on in China right now. It's a massive country. There are lots of controls on information. So what we're able to tell comes in bits and pieces from social media as well as the official media. There seems to be some difference between what's being reported. Social media seems to be saying that in some places there are lots of hospitalizations, there are lots of bodies at morgues and crematoria. The official media is seeming to play down the infection numbers, but of course, China is a massive country. It could possibly be the case that we have some hospitals and some morgues in some places being overwhelmed and other places that are not.
While media accounts of the truth may differ, for those living in rural China, a lack of medical resources means COVID could make this an extremely difficult winter. Asnaya, Chou and Sally Jensen for TaiwanPlus.